define addiction, there's lots of little succinct definitions that we can use, and they don't always encompass everything. So that's why I wanted to kind of get your concept of what it is, because it means different things to different people. So I don't like using a full-fledged definition, but talking about the component parts of what might be included in addiction. So let's look. All right, so here's one way of looking at it. It's saying that addiction is, among many things, among what you've already suggested, a chronic, recurring, relapsing illness. Chronic, recurring, relapsing illness that persists despite negative consequences. The related behavior is determined unacceptable by some predetermined standard. There is a perceived lack of control. Part of the thinking around addiction is that it is also a treatable brain disease. It's previously diagnosed as abuse or dependence, and currently diagnosed on a continuum of severity. So yeah, what you guys already suggested is definitely part of what is included here. It's number one, related behavior is determined unacceptable by a predetermined standard. So our cultural norms are violated in some way through addiction. It persists despite negative consequences. So even though you may not want to, even though you may not want to engage in the behavior, and very often you really don't want to engage in the behavior, you continue to, despite all of the overwhelming evidence that you should stop. One of the interesting things, and I think the most accurate part of this definition, is that it is a chronic, recurring, relapsing illness, and that once somebody sort of crosses the threshold into addiction, then it's not something that just goes away. And there's really very specific biological reasons for that. And sadly, the biological reasons are only now starting to become truly understood. So for most of, I guess, the 20th century, we've known about addiction, but we've had really no idea why it's a chronic condition. Why is it that someone who becomes an addict remains an addict? And it's part of why it's stigmatized, and it's part of why it's really poorly understood, is because there really wasn't a lot of evidence to show why it's this chronic, recurring, relapsing illness. This is part of what we understand when we look at addiction treatment, is that part of treating addiction includes relapsing. And we hate to say this to our patients or to our clients because we don't want to encourage relapse. But we also need to let them know that if relapse occurs, that's part of what happens in treatment, is that, okay, you relapsed, now what? You relapsed, what are you going to do about it? And as a treatment provider, we're always disappointed when we see someone that's relapsing, because we know what it feels like. And we know that people go through feel a lot of guilt and feel a lot of shame following a relapse, especially following significant periods of sobriety. So if they have a lot of success, and then they fall off and they have a relapse, coming back into the fold and trying again, it's really difficult. It's really hard to start again because they feel ashamed and they don't want to admit, for the most part, that they've had this relapse, that they've had a lapse. But it's part of the condition, and it's part of the condition because of the biomedical origins of addiction. And that's hard to get across to somebody in the throes of a relapse or in the throes of their addiction, but it's part of it.